Cardiovascular disease is one of the leading causes of death globally, usually right alongside or even overtaking cancer in some areas. It is of vital importance that clinicians are able to assess the immediate risk to an individual who happens to be suffering from heart-related symptoms and act in a timely manner. To assist in this assessment, clinicians in their career will make liberal use of various scales, grading systems, and frameworks. With this video, we are going to be talking about two which are commonly used to assess cardiovascular disease. TIMI, spelled T-I-M-I, and not like the name, stands for thrombolysis in myocardial infarction. Thrombolysis can also be called fibrinolytic therapy and is the use of medication to help break up blood clots. Myocardial infarction is when oxygen is limited to the heart, usually as a result of a blood clot. As such, the TIMI score literally means the use of medication to prevent a heart attack. The TIMI is calculated by measuring 7 different risk factors, and from that, giving the patient a score from 0 to 7, making it an easy and quick way to assess a patient. 1. Is the patient older than 65 years of age? This is important because as we get older, our risk of cardiovascular disease increases. 2. Has the patient used aspirin within the last week? Aspirin can help reduce the size of blood clots and is a common medication in relation to cardiovascular problems. As a result, a patient already on aspirin suggests there may be some underlying problems already. 3. Has the patient suffered from 2 angina-related episodes in the last 24 hours? Angina is the medical term for chest discomfort caused by limited blood and/or oxygen flow to the heart. 4. Does the patient have elevated serum cardiac biomarkers? These are enzymes such as troponin, creatine kinase, and myoglobin, which are released into the bloodstream when the heart suffers stress, inflammation, or is otherwise oxygen deprived. 5. Does the patient have an ST segment deviation on an electrocardiogram? This can be quite difficult to spot to the untrained eye, but if we look at a normal ECG and compare it side by side to an elevated one, we can see the difference. The ST segment measures the interval between ventricular depolarization and repolarization. Normally, we would expect to see a flattening before this repolarization. When it is elevated, we get this very sharp rise and absence of that short plateau. It's not just elevated we are looking for. Any deviation from the norm is to be noted. Exact form can be used to diagnose specific conditions, but for the purpose of the TIMI, any deviation scores a point. 6. Does the patient have any known history of coronary artery disease? I hopefully don't have to explain why that one's important. 7. Does the patient suffer from at least 3 of the 5 following risk factors? I know, we've just come to the end of one list, now there's another one, so let's use the phonetic alphabet for this. 7 alpha. Is the patient suffering from hypertension, also known as high blood pressure? For the purposes of the TIMI, we are looking for a reading greater than 140 systolic by 90 diastolic. 7b. Does the patient smoke? This refers only to whether or not they currently smoke, not if they are a past smoker, nor does it take into account chewing tobacco, vapes, or e-liquids. 7 Charlie. Does the patient have low levels of high density lipoprotein cholesterol? Here this is defined as a value less than 40 milligrams per deciliter. 7 Delta. Does the patient suffer from diabetes? Whether this is type 1 or type 2 is completely irrelevant here. And finally, 7 Echo. Does the patient have a family history of heart disease? If 3 or more of these factors exist, the patient is given a point for criteria 7. From this score, the clinician can then calculate the probability of the patient suffering from a heart-related event within the next 14 days, the information from which can be used to assess and adjust the possible treatment options. Whilst the TIMI score is used more often to assess the immediate short-term risk of cardiovascular disease, Qrisk calculates a person's risk of developing a heart attack or stroke over the next 10 years. Qrisk is an algorithm-based calculator that is updated frequently, with the most recent version as of the time of this video being Qrisk 3 2018. Qrisk was based on UK populations and as such, sadly, should not be used outside of the United Kingdom. As technology becomes more and more advanced, however, the implementation of technology in the healthcare setting is only going to increase. I feel confident that in the future, similar based algorithmic calculators will be created and implemented in populations across the world. I have to preface this section by saying that the results from a Qrisk test and any subsequent medical decisions should only be made by a patient in consultation with their physician. Now that my backside is sufficiently covered, if you do wish to learn more about it, it is a publicly available resource and I will leave a link in the description. So let's do a practice run. The criteria measured is different from the TIMI score, but let's do our best to make a patient history who would likely score a 2 on the TIMI scale so that we can compare them. We have a 45-year-old white male who is on blood pressure treatment, has a family history of angina or heart attacks, and has raised systolic measurements. From calculating their Qrisk, this individual would have a 7.9% risk of suffering from a heart attack or stroke within the next 10 years. This is a full 5.5% higher than the average for his demographic. Despite being of a healthy BMI and a non-smoker, this individual's family history leads him to having an increased risk. Whilst it can be horrible and stressful to have this information, being equipped with the knowledge empowers the individual to take charge of their health. If they know that they are genetically predisposed to a higher risk, then it means that they can more routinely be checked and not ignore any symptoms that they might otherwise not think anything of. Or you could be like a beloved relative of mine who lies to the clinicians about having chest pain to get out of the hospital early, continues to drink, smoke and eat chip butties in excess, and all around ignore any advice despite having 3 heart attacks and a triple bypass. At the end of the day, it is all about informing patients of the necessary information to help themselves through lifestyle changes. Whether they choose to abide or ignore that advice is down to the prerogative of the individual. These are just 2 of the grading systems used to assess the cardiovascular system. There are a plethora of similar scales at play in the medical world to assess all manner of different body types and different situations. For today, however, that's all from me. Thank you very much for watching.